using machine learning to predict hospital readmissions. In 2011, it was estimated that $41 billion in healthcare costs were attributed to hospital readmissions. The billions of dollars spent in healthcare costs have prompted the Centers for Medicare and Medicaid Services to implement an initiative called the Hospital Readmission Reduction Program, which financially penalizes hospitals with higher than average readmission rates. What is being done to address the issue of hospital readmissions? There have been a few proposed solutions noted in the research that show potential in reducing readmissions. For example, the Connected Transitional Care Program. This is a telehealth care transitions program that provides follow-up visits to high-risk patients post-discharge via telehealth appointments with a nurse practitioner. The role of the nurse practitioner in this program is to review the patient's discharge plan, complete the medication reconciliation, complete assessments, amend prescriptions, provide orders and/or referrals to necessary services, and provide guidance for medical concerns. Previous studies showed that there were some reductions in readmissions when the CTC program was implemented. However, a great number of patients were still being readmitted. Some of the contributing factors were lack of family caregiver involvement, lack of social needs not being addressed, language barriers, and cognitive impairment. As an alternative to the Connected Transitional Care Program, another solution to consider is machine learning. Machine learning incorporates the features of computer science and artificial intelligence and can be used for the purpose of predicting and optimizing. A proposed solution to reducing hospital readmissions would be to incorporate machine learning into the electronic healthcare record. Machine learning would be utilized to analyze and process comprehensive data from the EHR on a patient's physical, mental, psychosocial, and socioeconomic status, as well as identify patterns of hospitalization. And here's a snapshot of how machine learning would work with the EHR. First, the machine learning would be integrated into the EHR by software engineers. Next, the machine learning would be programmed to analyze and process the data in the EHR. And third, the machine learning predictive analysis algorithm would be activated to make predictions about patients who are high risk for readmissions. There are specific machine learning algorithms used in predictive analysis. I listed those algorithms on the side of the third box. Integrating machine learning into the EHR could be beneficial to nursing practice, and that patients who are a high risk for readmissions can be easily identified and early interventions could be implemented. Machine learning could also help to streamline nursing workflows by providing a more comprehensive clinical picture of the patient, which can guide efficient care coordination. Anticipated cost factors would be employment of software engineers, hiring IT personnel to manage the machine learning, training of staff, and cybersecurity. Financial implications include reduction in hospital readmissions, shorter length of stays, and improved workflows that will save time and reduce burnout. Machine learning has the potential to improve clinical practice by predicting readmission risk, resulting in timely diagnosis and effective treatment of a health issue, the prevention of complications due to delayed or incorrect treatment, and the shortening of hospital stays. Still, further research on the use of machine learning and predicting hospital readmissions would enable early risk prediction, foster preventative strategy for high-risk patients, and improve quality of care.